afternoon, everyone. Next up on stage is Mr. Amit Jindal, CEO, Root Tally AI. He has boasts of an extensive experience in artificial intelligence with multiple research papers published in prestigious A-star conferences. He has held positions in the research divisions of leading companies like Amazon, Nvidia, and Mercedes Benz. As the founder of Root Tally AI, Amit leverages AI technology to conduct comprehensive health assessments, offering innovative solutions for individuals facing issues related to poor posture or musculoskeletal conditions.
Hi everyone, I'm Amit. I started a company called Root Ally AI, which focuses into building musculoskeletal preventative health solutions and treatment programs. So the problem, which I wanted to solve was I actually faced from a lot of injuries from running, and when we get insurance, I realized like a couple of problems. Companies these days are not focusing on high utilizers, and they are not using the data efficiently on understanding how they can reduce their claim cost. And a lot of cases are actually straight through processing, so they are not able to actually filter out high claim users from it because there's no way to underwrite and understand the risk score. So we want to make this process better and provide a personalized care program and treatment for those users. So what we built was a comprehensive health risk assessment, and in that we actually do health fitness assessment where we can check users' cardiovascular endurance, fitness, flexibility, all through camera. We don't require any additional sensors. Then we can also do the posture analysis. As you know, a lot of people, have poor posture due to back pain, neck pain, sitting for long hours. We all have that problem. So we want to solve those problems early, make it easy, accessible to everyone. And we can even do body composition assessment by taking your body pictures and understanding your body fat, metabolic age, metabolic rate. And these parameters can be very important as a preventative health screening. So I'll show you a quick demo of how this solution actually looks like in real life. Just give me a minute, they are switching to the video.
iOS, Android, or web. Simply follow the on-screen instructions to perform a series of exercises. Our advanced AI captures essential data, delivering instant reports. For example, for your body fat percentage, posture imperfections, and more, all to help you understand your health better. Alacare is fully accessible on any device, iOS, Android, or web. Simply follow the on-screen instructions to perform a series of exercises. Our advanced AI captures essential data, delivering instant reports. For example, for your body fat percentage, posture imperfections, and more, all to help you understand your health better. Alacare is fully accessible on any device, iOS, Android, or web.
So this is how it roughly looks like. It's a mobile app, doesn't require any additional sensors, and it can track your body. So we use this to actually understand your health risk and also give you follow-up customized programs for you. Let's say posture is bad or your cardio is weak, so we can give you programs accordingly. And these programs get updated as you're doing better without any third-party intervention. So we are trying to create this end-to-end journey to improve health outcomes. And so you get this exercise program like this, and you can follow along with the AI, which gives audio instructions. And we have this in different regional languages. So we do a lot of screening in tier 3, tier 4 areas, where people are not English that much familiar. So it's easy for them to use in Hindi, Marathi, different languages. And they can get the clinical insights. And we have a clinician dashboard also where they can monitor them, use it as a remote monitoring platform. So we work with hospitals and orthopedics clinics to use this for their patients as well. So we can do it, we deploy it in different ways. One is as an on-site screening, so we do a lot of corporate screening at on-site. And this can also be set up as a kiosk, which can be as a long-term screening, in remote areas or in offices as well, or different locations. Third is we have a web app also, which can integrate into other people's insurance apps or different platforms to give a more wider reach to our solution. Apart from the assessment I showed, we also do like joint risk assessment to cover all the major areas, back pain, neck pain, shoulder, to understand if the person has osteoporosis, ACL, different kind of conditions. And we use this with insurance companies as a triage mechanism to understand if the patient already has some problems, so how this risk should be evaluated and how they should be triaged. We have done already this clinically validated studies to show how we can improve patient outcomes with multiple hospitals in Singapore. And we have post-care programs as well on the preventative side, where people with early onset of back pain, neck pain, they can go through these posture programs, ergonomic programs to get better and prevent these kind of issues coming in future. Then we have our MSK rehab programs for people who already have chronic issues. So we have a digital pain management clinic, which is tele consultation with our platform, which will deliver exercise virtually. So it's easy to access for remote people. And then lastly, post-discharge care management program as well to prevent readmission rates. So these are the major conditions which we can cover, like back pain, neck pain, any kind of musculoskeletal conditions, or it can be used for post-orthopedic treatment like knee replacement or hip replacement pathway. So it can be fully automated for the protocol, or it can be used for normal wellness and active living conditions. So our USP is we are kind of an end-to-end solution which covers screening and treatment part both. And then we have a clinical validated solution which is a class 1 medical device as well, registered in Singapore. So the relevant use cases which we are working with insurance companies is on STP cases. So we want to help better underwrite STP cases, which I mentioned initially. So with this cases, the users can do this assessment easily at their home. It doesn't require any setup, so it's a quick assessment, and the insurers can better underwrite this. And even for the current PPMC, this can be used as an add-on to check for orthopedic conditions, which current PPMC doesn't really check, and give people who claim early, for getting, they already have some pre-existing injuries, and then they go and claim within 30 days, 60 days. So we can prevent those using these kind of assessments. Then for, kind of revenue generation, this can be used as a way to screen people, understand what stratification people are, and upsell kind of PA or kind of insurance policies to the low risk and give care management programs to the high risk individuals. And this is, can be personalized for every user. It's not very specific because it's depends on your screening results, and it's very personalized program to you and how someone is also intervention and prescribing you. So it's very personalized, and it's easy to scale also in different geographies. And lastly, this can also be used to, for return on premium products. So we already work with insurers to do these assessments with their policyholders as an engagement, and then they can, for the more fit people, they can give return on premium discounts at the time of renewal, and other engagement loyalty programs, how, other insurance companies like Vitality and, they do it. So we want to create that end-to-end engagement mechanism. Yeah. Yeah. Thank you.